So today's topic is going to be sclerotherapy for spider veins. I see a lot of patients with sclerotherapy issues. So spider veins are really, really common. I mean, if you look at your legs, you're probably going to have some depending on your age and your family history, whether you've had children, ladies, or not. So these things can run in families, and some people have symptoms from them. I mean, insurance companies say they're asymptomatic. They're not. You can have symptoms from some of them. Symptoms can be mild, from itching over the vein, or I've heard complaints that I had this really sudden onset of stinging pain, and all of a sudden this cluster of varicose veins or spider veins showed up on my thigh or below my knee. So they can cause symptoms. The issue is, how to best manage them. There's different ways of treating them. There's a laser or there's sclerotherapy. I had the laser myself. I tried it. I actually tried it on myself, and I found it to be pretty uncomfortable. I'm pretty pain tolerant, but I thought it stung and hurt a lot more than the injections, which I've also had done, just to try it out. But essentially what we do is we do injection sclerotherapy for spider veins. If that's your main complaint, spider veins, injection sclerotherapy is fine. If it's other vein related issues such as leg swelling or all that other stuff, then we get more aggressive about it with evaluating you for ablation of the saphenous vein and conservative management, all that stuff. But if it's just purely spider veins, I think injection sclerotherapy is what I'd recommend for most patients. And I tell them, look, you can get this done. You're going to get clearance of about 70% on your spider veins, but don't, again, just like all vein problems, don't expect that you won't get more veins somewhere down the line. You will. Anybody who tells you that one and done for spider veins is the way it is, it's not. You're going to get some more spider veins, and you may need touch-up work done, between 2-3 years down the line, just to get rid of the ones that reaccumulate. And so sclerotherapy is a fairly simple procedure. You really don't need any topical anesthetic for it unless you're really squeamish about needles, because these veins are very, very superficial. These veins are really not doing you any good. It's not like they serve a useful purpose for you, but they're just underneath your skin level. We use a 30 gauge needle. There's different medications that you can use for sclerotherapy. We currently we use Sclerodex, but there's different medicines you can use, Sotradecol, Polidocanol. I used to use Sotradecol years ago, and it may have been just my experience with it, but I found that patients tended to stain a lot more with it and sometimes get ulcers from the Sotradecol. Maybe it was the concentration we were using, maybe it was overly aggressive treatments, but I just was not particularly happy with Sotradecol. Although a lot of people use it very well and have good results with it. Hypertonic saline, you've probably heard of years ago. Hypertonic saline was used. That really stung, so we don't really use hypertonic saline anymore. So Polidocanol was first developed as a local anesthetic. That seems to work pretty well. I think it's less painful than other treatments like Sotradecol. Doesn't sting and burn like Sotradecol. And I was not happy with the results, so we switched to Sclerodex, and it works pretty well for us. In our hands, it works well. We have nice results. I always tell people, look, you can get about 70% clearance. It's not going to all go away. And so they come in for several sessions, get treated, compressive wraps, take it easy that day, go back to normal the next day. So in terms of recovery, there's not much to it. You can go back to normal the next day. Do I recommend you wear support stockings if you're on your feet a lot at work? Yes, I think it's a good idea to prevent you from having more spider veins. But it's a treatment that's works well for a select group of patients who have really isolated spider vein problems. Tomorrow we'll talk. The next talk we'll talk more about deep venous thrombosis, particularly acute deep venous thrombosis, which is that scary stuff. That's the stuff that breaks off and goes towards your heart and lungs. We'll talk about the symptoms of it, the diagnosis, and the treatment plans. And then we'll go further into another episode of, pulmonary emboli, how you manage it, what are the treatments for it, and discuss um, the signs and symptoms of it and what happens when you have pulmonary embolism.